Hi, Mrs. Smith. I'm super excited that you get to go home from the hospital this weekend. While you were here, you were treated for a severe allergic reaction because your body went into anaphylactic shock due to your exposure to peanuts. This type of allergic reaction can be life-threatening because of the bronchial constriction, airway obstruction, and vascular collapse, which is also shock. And some other common triggers of this are medications and bee stings. And so anaphylactic reactions are super serious and they can lead to death if they aren't treated properly. So I wanted to go over a few things with you. So if this were to ever happen to you again, it's super important that you call 911 immediately so that you can get the help you need promptly. And while you were in the emergency department, we needed to reverse your anaphylactic reaction, so you were given epinephrine. And epinephrine is a bronchodilator and vasoconstrictor that inhibits the release of mast cells from mediator cells. So basically this means that the medication helps open your airway so it's easier for you to breathe. And in case that you have an allergic reaction again and need to take epinephrine, I wanted to make sure that you were aware of potential side effects. This doesn't always happen, but there is a possibility that you can experience angina, arrhythmias, hypertension, tachycardia, restlessness, nervousness, or tremor. And then since you did have such a severe allergic reaction, the healthcare provider actually did want to prescribe you an EpiPen, which is something that you can carry with you at all times. It's super similar to like a shot that you would give to yourself. And it contains epinephrine, again, which is the same medication that you were given in the emergency room. And if you ever need to use this, it's super, super important that you tell your healthcare provider almost immediately after and that you still do come to the hospital so you can get the proper follow-up care. And it's super important that you only use one EpiPen or one dose, because if you use more than you are supposed to or overdose, you can die from that. So it's super important just to use one and follow the dosage strictly. And then lastly, before I let you go, I just wanted to make sure you didn't have any questions, and if you did, I'd be more than happy to answer them so you don't have any questions when you go home. But lastly, one more thing is that I just wanted to make sure that you understand what you would do if you were having an anaphylactic reaction. So if you just would kind of talk me through what you would do, just so I know that we're both on the same page before I let you go. But other than that, I'm super glad you're feeling better, Mrs. Smith, and I'm super happy that you get to go home. Be careful, have fun with your family, and make sure you stay away from peanuts.